All right, as Roshi discussed during our opening, Arizona Bold Forward was really an important investment in our future, in Mayo Clinic's future. And Mayo Clinic is continuing to invest in our future in terms of our physical structures and how we put all of that together. And you may have heard this referred to as Bold Forward Unbound. That is the way we're describing all of the movement forward in our physical structures and how we transform the way those physical structures allow us to care for patients, carry out research, and education. You may have heard some aspects of that, including in Florida, hospital expansion, cancer center, Bold Forward Unbound in Rochester. But there is more to come in Arizona as well. We're not done with Arizona Bold Forward, and many of those plans are moving forward. But for many of you who have been here on the Scottsdale campus, you may say, yeah, but most of the attention has been on the Phoenix campus. What about here? So we're here to tell you that, yes, we are investing in the Scottsdale campus as well. And there are a lot of plans underway. Actually, Dr. Rank was a key leader in those plans, but we're referring to those as Scottsdale Transformation. And we want to now welcome two additional leaders working in this Scottsdale Transformation space, Dr. Joe Hawksworth and Bridget Shelton. Can you please join us? Thank you both. Thanks for being here. And Dr. Hawksworth, you're the chair of our Space and Capital Committee. So as you and your team were brought into this Scottsdale transformation work that was underway, tell us a little bit of how you approached it and where you started.
Well, as you briefly alluded to, we actually built on the work of others. So Dr. Rank and a number of other colleagues had a task force going on for the better part of a year, really brainstorming to look at what is the future of this campus, sky is the limit, what's possible, what's not possible, and getting some iterative feedback from the EOT on what direction to take. And then when we came into it, a lot of that work highlighted some of the complexities and interdependencies that there would be. So, examples include that trying to figure out, not just for the next few years, what is the clinical components of this building, but what's it going to look like for the next 10 or 15 years if we're going to invest that much capital in trying to create transformative modern spaces for different parts of the practice. Likewise, we had to figure out practical aspects from a phasing perspective. When you think about, we can't shut down the building. We can't do it all at once. It's inherently going to have to be, a project that has multiple phases between now and probably 2030. I'm sure, Roshi, I know you want like modern bathrooms, but if
how many people want better bathrooms on Scottsdale?
But then you have to ask the question: how many people would like me to take down all the bathrooms at the exact same time to renovate them? Then it becomes a little more problematic. So we had to figure out what is the lowest hanging fruit. We wanted to see action sooner than later, and so some of those things that really percolated to the surface would include common areas on first floor and concourse, and then public restrooms, because those are relatively agnostic in terms of what the future clinical components are here on this campus. Last summer, we started meeting with leaders like the two of you and members of the EOT, looking for high-level strategic vision on where we needed to go with phase one. We hired Shepley Bullfinch as our external design firm, and have gone back and forth with them for about 6 to 7 months now in an iterative process, trying to come together with some preliminary design concepts. And then we were very grateful to pull in about 25 different stakeholders from staff here who would consider this campus home. And they worked with us in January and February to give additional feedback on refining that, which has brought us to the final design that's being unveiled here today. But I'd really like to emphasize that, the clinical work, the staff areas, that's really the heart and soul of what we do here. And although we're starting in the common areas, those areas aren't forgotten. They are forthcoming, but just a few more pieces of the puzzle that we need to put together before that happens.
Step one. Yeah. So I know with Arizona Bold Forward, an emphasis was looking at the future. How do we blend the best of digital care with physical care and make some of that more seamless for our patients and for our staff? And that's continued to be an area of emphasis with Bold Forward Unbound. And as we continue to plan for both Bold Forward Unbound in Arizona and what encompasses Scottsdale Transformation, what are some ways that we are thinking about that aspect moving forward?
Yeah, that's a great question. I mean, we all see it in our practices every day, whether you're inpatient or outpatient focused. Interface with the portal, virtual visits, advanced care at home has become an increasingly big part of our practice. And it's true that we need to figure out how do we integrate our physical spaces with that digital connectivity. And importantly, I think, how do we look at as an outpatient facility here on this campus, how do we tie in that seamless arrival experience or an effortless handoff between the digital to the physical of I'm here to be seen now? And I think the single word that I'd use that summarizes it is flexibility. We recognize that there's so much work ongoing across the enterprise now with things like the platform and CDH, the work that's already well underway, as you'd mentioned, with Bold Forward Unbound in Rochester, that one thing we know for certain is that we don't know what's to come entirely. And so we have to build flexible spaces that will be able to evolve with some of this modern technology that comes when it's debuted across the campus. And at the same time, I think we have to realize that there are important physical changes that can help us interface the digital with the campus. And some examples of that would include things like wayfinding. We recognize that, yes, there will be plenty of our patients in the future who walk into our building and your phone immediately greets you and it tells your care team that you're there and tells you how to get from point A to point B. But we also know that plenty of our patients don't use that technology and need some additional help. And so we're really trying to simplify things like wayfinding to get rid of the numerous signs that are plastered everywhere and focus on bolder but more limited signage, and coupling that with contemporary design features that really, it's kind of like follow the yellow brick road, if you will, of intuitively telling somebody to get from here to there. And also, importantly, trying to recognize some safety features, like we would like to steer people away from the stairs, patients away from the stairs, unless they make a deliberate choice to use the stairs. Waiting of the future is going to be very different in our facilities compared to what it is now. We don't want people to feel like they need to go and sit there in a row of chairs, that they want to have digital connectivity. We need to provide mixed use type seating and electrical connectivity, network connectivity, so people can use their devices both for their healthcare and not, sort of akin to a modern airport lounge, if you will. And then lastly, one of the things that came out of our stakeholder meetings was basically a discussion of sometimes we see patients that come here for a physical visit, and yet to complete their point of care, they either need to get on the shuttle to go to the Phoenix campus, or they're scrambling to try to find a quiet place to have a virtual visit via their phone from this campus. And so I think that's another great aspect of the digital practice, that we need to look at providing modern, private, contemporary spaces where a patient could actually retreat to allow them to complete their point of care, even if that's digitally connecting to Phoenix or Rochester or Florida, for example.
Yeah.
Right.
So Bridget, you're one of our architects. You do a lot around planning and design of new spaces. So tell us about this new space.
Sure. So Dr. Hawksworth touched on a couple of the key components, but some of the big moves that we'll see are those much needed restroom renovations. We are starting with the public. We will actually be creating a color palette for the staff restrooms as well. But once again, we have to start somewhere. We're also going to significantly change the first floor entry experience. You'll see some of that in a little bit. And modifying some of the grand stair to make it safer, because there have definitely been some issues with it. As part of this first phase, you'll see a new color palette for the Scottsdale campus. It will include new finishes, some that we haven't used on this campus before, as well as some new furniture with integrated technology, some dynamic artwork that we haven't had previously, and some additional wayfinding or different wayfinding, I should say. Yeah. So
who wants to see it in action? Okay. So let's take it away.
Okay. So when you enter the first floor, you'll see the color palette much lighter and much brighter than we've had on this campus before. We're going to shift the information desk off to the side, which will allow us to open up the elevator bank, which is actually immediately behind the desk today. That provides a much clearer wayfinding path for patients. It will actually allow us to take down the volunteer desk that is actually currently in this area right now. Will provide us some opportunities in the future to add additional waiting or check-in as the clinical practices evolve on this campus. As we work our way down the stair, there is a significant art piece planned for the left wall, currently shown in white. You'll be able to see from concourse to third floor. The stair itself, we're actually going to straighten out at the bottom. We're going to remove the flare to try and downplay it as a key circulation element. We will actually be adding, changing the material of the stair, adding nosing for more contrast, and then some lighting too that should help with the shade and shadow throughout the course of the day. Straightening that out provides an opportunity for a wayfinding ambassador potentially in that location, because this really is a key circulation area of the building. As we progress towards the atrium, you'll see that the ceiling and the floor are designed to complement each other. And the new blue wayfinding elements that we've actually started implementing on the Phoenix campus have helped quite a bit with wayfinding. You'll also start seeing some of the new furniture selections. We're really trying to provide a mix of furniture with integrated technology, with lounge furniture, so that patients and staff have opportunities to work and make themselves feel more comfortable while they spend time on our campus. And we're also going to slide the information desk closer to the elevator bank for more of a concierge level of service. As we spin around, we are working through what that virtual visit should be. You'll see some phone booth-like elements in here. We're not married to that idea yet. We just put it in the rendering because we know we need to find a home for this. So we're acknowledging that that is a work in progress. And then this, that very last image would be the entrance experience from the elevator, or the parking deck elevators. And you can see that the floor and the ceiling element are designed to mimic each other and create a very clear path from elevator bank to elevator bank, because it's amazing how many people get lost in our facilities. So.
It is amazing. Until we started this work, I didn't know that we could blow through that big, thick brick wall that's right behind our entryway desk and actually have our patients see the elevators as soon as they walk into the first floor. So that's really amazing. And overall, as I saw these images, I thought, wow, this feels so much more modern, so much lighter, so much brighter. How do you see these design elements kind of pulling through to other parts of Bolt Forward Unbound?
So this is actually an effort that started at an enterprise level a number of years ago. This is really our first opportunity to start pulling in some of that lighter and that brighter feel into some of our capital projects. But you'll start seeing that same theme, that lighter, that brighter, more modern elements being integrated into not only our strategic work, but our capital and our expense work as well.
So how long is it going to take until we get to see our space looking like this?
Always the key question, right? So we actually, our PM&R project, which you will start, the blue image that was shown behind us, which was actually the great work led by Carol Benson. You will start seeing that show up all over campus and associated with all the work probably from between now and 2030. Our PM&R project being the first project that will be starting construction. That is actually supposed to start in Q2. So we'll start seeing some things pretty quickly on that one. And then much of this work, we believe, will start in Q4. Our team, which is actually led by Jamie Townsend, Amy Kim, and Maria Seifert, are still working through the phasing and the estimates. But they do feel pretty confident that we'll see work before the end of the year.
Great.
So what do you all think? Do you like what you're seeing? All right. Good. And again, thank you to many of you who were able to give stakeholder input on all of this.
Yes. And thank you both so much for just the incredible work to redesign our campus for the future. I'm incredibly excited to see what the future holds for Scottsdale, and excited to see the construction start.
It's our pleasure.
Thank you.
Thank you.
Very
Thank
good.
you.
Thank you for
Thanks.
joining us. Thanks so much, Carol.